I found a positive pregnancy test in my 16-year-old daughter's bathroom, and I spent 3 weeks planning how to support her before I saw the hospital paperwork. The pregnancy test was in the trash can under wadded tissues, 2 pink lines, clear as day. My hands went numb. My daughter Emma is 16 years old. I didn't confront her immediately. I needed to think, process. My husband was on a business trip in Seattle, so I was alone with this information for 3 days. I watched Emma carefully, looking for signs I'd missed. She'd been tired lately, sleeping until noon on weekends. I'd thought it was typical teenager behavior. Now it felt different. She'd been emotional too, crying during a Target commercial last week. I'd assumed it was hormones. Wrong kind of hormones. Then I noticed her eating habits. She'd stopped drinking coffee 3 weeks ago, said it made her nauseous. She'd been eating saltines in the morning. Just saltines. Nothing else until lunch. My stomach dropped. Morning sickness. I started making a list in my head. How to tell her father. Whether she'd keep it. What this meant for college. She'd been accepted to Northwestern. Full ride. That was gone now. My throat tightened every time I looked at her. Wednesday, she came home from school and went straight to her room. I heard crying. I knocked. Emma, you okay? I'm fine, just tired. Her voice was thick. Definitely crying. Can I come in? No, please, I just need space. I gave her space, but I couldn't stop thinking about it. Thursday, I noticed she'd been wearing baggy hoodies in 80-degree weather, hiding something. I checked the laundry, found a pair of jeans with the button extender, the kind pregnant women use when their regular pants don't fit anymore. My chest felt tight. This was real. This was happening. Friday, I saw a medical appointment reminder on the kitchen counter. Dr. Patterson, Tuesday 2 p.m., bring insurance card. I took a photo of it. Googled the doctor, obstetrician. My vision blurred. I called my sister that night. Emma's pregnant. What? Are you sure? Positive test, morning sickness, baggy clothes, appointment with an OB/GYN. What else could it be? My sister went quiet. Have you talked to her? Not yet. She doesn't know I know. I decided to wait until after the appointment. Maybe she'd tell me herself. Tuesday came. Emma said she had a study group after school. She left at 1:30 p.m. I knew where she was really going. I couldn't focus on anything. I cleaned the kitchen 3 times, reorganized the pantry, anything to stop thinking. She came home at 4:15 p.m. Red eyes. She'd been crying again. How was the study group? I asked, giving her a chance to tell the truth. Fine. She went to her room, closed the door. That night, I couldn't sleep. I kept thinking about my daughter. 16, pregnant. How did I miss this? What kind of mother doesn't notice? I got up at 2 a.m., walked past Emma's room, saw light under her door. I pressed my ear against it, heard her on the phone. I can't tell her yet. She'll freak out. My heart broke. She was right. I would freak out. But I needed to be there for her, support her, whatever she decided. I made a decision. I'd tell her I knew. Tomorrow, no more waiting. Wednesday morning, I made breakfast. Emma came downstairs in another baggy hoodie. I took a breath. Emma, we need to talk. Her face went pale. About what? I found the test. I know about the appointment, and I know you're scared, but she started crying hard. Mom, I'm so sorry. I wanted to tell you, but it's okay. We'll figure this out together. She looked confused. Figure what out? The pregnancy. Emma's face changed. What? I'm not pregnant. My brain stopped working. The test. In your bathroom. That was for Kayla. Who's Kayla? My best friend. She thought she might be pregnant. It was negative. False alarm. Relief and confusion flooded through me. Then what's going on? The doctor appointments. The crying. The baggy clothes. Emma's hands shook. I'm donating a kidney. The room tilted. What? To Kayla. She has kidney disease. She's been on dialysis for 8 months. I'm a match. The surgery's in 2 weeks. She pulled papers from her backpack. Medical consent forms, surgery schedule, pre-op instructions, all dated, all real. The morning sickness is from the medications. The crying is because I'm terrified, but I can't tell Kayla I'm scared. The baggy clothes are because I've gained weight from the steroids they put me on. I couldn't breathe. You're 16. You can't just... I'm saving her life, Mom. That's why I couldn't tell you. I knew you'd try to stop me. The surgery happened. Emma's fine. Kayla's fine. And I spent 3 weeks worried about the wrong thing.